I think your biggest lesson learned is exactly that. You can't predict infectious diseases. You can guesstimate, I guess, that you would say, oh yeah, the majority of them will happen in these populations based off what is happening in those areas, but we always need to be prepared for it. And again, that's what the US learned on a very big scale. You saw with the media and everybody else was, we went from having very few areas that knew much about biocontainment to pretty much every hospital doing biocontainment lessons learned, doing proper donning and doffing of protective equipment, to full-on drills, incorporating multiple facilities, all within a matter of months because of this. I think that was the biggest lesson learned is, we weren't ready for it, and that's okay. But that's how we learn, is by those experiences. That was definitely one of our big lessons learned. That's where we focused the majority of our training time, was how do we get in this equipment appropriately so that we're 100% covered, that we are safe, to how we're going to get out to minimize that exposure, because that is actually, with highly infectious diseases, the highest risk point is not necessarily the care all the time, but it's the removal of that equipment to minimize that exposure to the individual healthcare provider. Because again, the priority is, you have to care for the patients, but if your healthcare providers are all sick, you don't have anybody to care for them, so you have to manage them better and make sure that they're 100% safe. So that was definitely the big train up, was, hey, PPE, donning and doffing, that has to be 100% before we can even move forward. Again, it's a little different, like you just said. Military, we have the ability to kind of continue to monitor overseas, in country, in a little bit more isolation, a little bit more controlled environment. That way we're not sending back a whole regimen of military personnel at once, hey, disperse out to the, wherever you go. We can actually keep them in those areas for an extended period of time to just monitor and make sure that they are either cleared, or that if they do present with symptoms or some concern, that we can send them to the correct facility right away. So I think that is one of the benefits for us in the military, is we have that ability to help extend some of the isolation and make sure that they are safe to return back to the general population and back to their home of record and their duty station, so that we don't have to worry about accidentally spreading something that we don't need to. I think we've started it. I think it's not a random act. I think it's something we're going to be prepared for, that we have to constantly be prepared for. And I think this was that jump start that kicked us into that high gear. With the military, we've always training with, briefing and preparing for biochemical, radiation, all those kind of warfare potentials. And we have obviously done that with all the training we do. That's what the military is here for. But from the medical side of the house, now we've actually jump-started that. How are we going to manage that at a much bigger scale and move towards that throughout our DoD system? I think there's always room to improve. I think there's always ways to make this better. But again, that's what it makes it so unpredictable, because we don't know what the next highly infectious disease may be. It could be something that's entirely airborne, which we are preparing for that. It could be something complete that we've never even thought of. You just never know this day and age, unfortunately, what's going to come down the road. So there's always room to grow. There's always room to improve. We just have to kind of guess and say, hey, it could be this, it could be this. How do we protect ourselves, and how do we manage that, and just start moving that direction? From a provider standpoint, it's good biological chemical course is always a good backbone, just to give you some basic knowledge. Knowing your resources, who you need to contact if you have concern, that's obviously a big thing to have. I mean, we even do it here. Our providers have the numbers to, our local health department, the CDC. That's something that we keep readily available for this, because of these events now, is having those resources, knowing who to call and who you need to notify, so that you can manage those patients appropriately. I think that's probably one of the big lessons learned for all our providers to have. I think at this day and age, after 2014, definitely. I think that we've moved with the outbreak of 2014 of the Ebola. All hospitals have moved towards this future of biocontainment, and realizing that it's no longer just military needs to worry about it, or these big hospitals like Nebraska, Emory need to worry about it. That the small hospitals have to start thinking about how are we going to contain it at some extent, until we get to the next bigger facility. And so I think as a whole, the U.S. is definitely more moved towards that comfort level of, hey, we have to be prepared. For us, it's containment for the DoD, because again, we're in such a unique facility that we don't have as much interaction with the general population because we care for such a specific population. So one of the things that always keep us at night, especially with the military, for me, which is kind of a little different than what your question asked, is the military turnover. So it's maintaining our personnel, which is such a key component of that drilling process that we talked about, that I mentioned earlier, is how important that is for us with the DoD and with the military, is constantly training our new people up and getting them prepared and ready to use the equipment. So that's one of the things that's always kind of keeping us up and concerned at night is, hey, is our staff ready? Yes, they are. Okay, great. Next week, are our staff going to be ready? Yes, they are. Okay, 2 months from now, are we going to get new personnel? What do we need to get them ready? And so that's kind of one of the ongoing challenges that we always face and that we're always dealing with day to day.